watching News Channel 11 at 5:30.
Hospitalizations related to COVID-19 saw another increase in the region over this past weekend. Now we're above 250 again. Ballad Health's reporting 253 COVID-19 patients, up 19 from just Friday, and 68 of those patients today are in intensive care. That's an increase of 12 over the weekend. Of those, 51 are serious enough that they need to have a ventilator to breathe. An increase of 8 on that vent count. And Niswonger Children's Hospital, currently they are treating 4 pediatric COVID-19 patients. Those are 4 kids who are now hoping to get home for Christmas. Happy to have with us Ballad Health's Chief Clinical Officer, Dr. Amit Vashist. Thank you so much for joining us, Dr. Vashist. Your reaction to the numbers, I'm guessing you're a bit concerned.
Thanks, Josh, for having me. It's great to be with you and our viewers. Our numbers continue to concern us, especially in the wake of the post-Thanksgiving celebrations. Our inpatient numbers, people who have been hospitalized to our facilities, have continued to creep up. So have the number of people being put on ventilators and in our intensive care unit. And the other unknown element is what will the Christmas celebrations bring for us and our community. So overall, very concerning picture here with us at Ballad Health.
You walk us through numerous data points, hospitalizations, new cases, things like that. But I want to ask you about community spread, COVID spread, and how concerned are you about how, I guess, prolific the virus is right now, once again, in our community? And are you seeing within Ballad any projections of where that might be going?
I think our projections are that the cases will continue to spread. We can, as of today, as you mentioned, we have about 250 plus patients admitted to our hospital, with about 51, 52 patients on the ventilators. So our projections are that if we will continue to increase unless we develop some mitigation strategies that our community does. So, I mean, we have to just encourage folks to continue to socially distance, to mask if you're indoors, particularly if you don't know the vaccination status of the individuals that you are gathering with. Of course, we continue to encourage people to get vaccinated if you haven't already. And if you are an adult and more than 6 months out after your second dose of the mRNA vaccine, please consider getting your booster shot now, especially with the Omicron variant hovering around us.
And that booster could be a real help to protect you even by Christmas in a couple of weeks?
Absolutely, and this is one of the things that we have been reiterating time and again, that, you know, right now we are seeing we are not out of the Delta wave as yet, and our estimates are that we will soon be in the next few weeks with the Omicron variant all around us. And one of the things is, after 6 months, your antibodies continue to go down after your second dose of the mRNA vaccine, and boosters offer the best protection, Josh.
All right, let's talk about capacity. Here we are again. Are you worried about having available beds in ICU and even general beds for COVID patients as you move into the Christmas holiday, a year after such a horrible Christmas holiday, I know, within your hospitals?
Josh, we continue to evaluate our readiness in terms of number of beds available, therapeutic modalities, ventilators, all those kind of things. I think what we have said and reiterated time and again is it is not really the number of beds that seem to be the problem over here. It is the personnel, the nursing staff, respiratory therapists, phlebotomists, all those personnel that are required to man those beds and serve those patients who have COVID-19 and have a very high clinical requirement of the care that they receive. So compared to last year, of course, our staffing has gone down somewhat. Also to factor in is the huge rates of burnout that we are seeing within our frontline caregivers.
Yeah, I can't imagine. Let's talk about the Omicron variant. So tidbits that we're hearing in terms of national news reporting is that it doesn't necessarily appear to be worse than the other variants, and also that it is responding well to the Pfizer booster. How, you mentioned a moment ago, you're bracing for widespread Omicron variant in our community eventually. How concerned are you about the emergence of that variant on our local health population?
Josh, the early the data is still very early and preliminary. So we have read a few studies where they are postulating that the variant may be a little less severe than what possibly the Delta variant was. But I'm not too convinced till I see more data and have a chance to review it in full detail. Here is what we know about the Omicron variant, that it is much more contagious and much more transmissible than the Delta variant. And 2 doses of vaccination, especially after 6 months, may not be enough in treating patients who may have COVID-19 through the Omicron variant. So getting a booster is a must if you are 6 months or more out after taking your second dose of mRNA vaccine. I might as well add that 46% of our community has received complete vaccination against COVID-19. Out of that, only 27% so far have received a booster dose. So we got still a substantial number of folks who have not received a booster dose. Now, when I say 46% of folks have taken a full dose, 2-dose vaccination against COVID-19, that means 54% folks in our community have not. So I would encourage people who are not vaccinated to consider getting vaccinated at their earliest convenience. Omicron variant, we continue to be very concerned. We are evaluating all bits and bits of data that come our way. On the weekend, we saw there were 2 cases that were detected in Western Tennessee. Our estimate is that it is already there in sizable parts of our state, and it may be spreading already. Josh.
Dr. Amit Vashish with Ballad Health, thank you so much, and our best to your team as you head into the holidays. We appreciate it very much.